Have you ever wondered why some diabetic patients inject insulin just minutes before eating and still manage to keep their blood sugar under control? What makes NovoRapid FlexPen different from regular insulin? Can it really help prevent dangerous blood sugar spikes after meals? And most importantly, are you using it correctly? Or could a small mistake be putting your health at risk every single day? Today, we're uncovering everything you need to know about NovoRapid FlexPen, from how it works inside your body to the proper timing, dosage, benefits, side effects, and the common mistakes that many diabetic patients make without even realizing it. Some of the information in this video could help you avoid serious complications and improve your diabetes management significantly. So stay with us until the very end because every section builds on the previous one, and by the time this video is over, you'll have a complete understanding of NovoRapid FlexPen that most patients never receive during a routine clinic visit. Let's begin. What is NovoRapid FlexPen? NovoRapid FlexPen is one of the most commonly prescribed rapid-acting insulin medications used in modern diabetes treatment. Its active ingredient is insulin aspart, a modified form of insulin designed to work much faster than regular human insulin. The purpose of NovoRapid is simple but extremely important. It helps control the rise in blood sugar that happens after eating meals. Every time you eat carbohydrates, your body converts them into glucose. That glucose enters your bloodstream and raises your blood sugar levels. In people without diabetes, the pancreas quickly releases insulin to handle this rise. But in diabetic patients, this natural response may not happen properly. That's where NovoRapid comes in. NovoRapid acts like the body's natural mealtime insulin. It begins working quickly and helps move glucose from the bloodstream into the body cells where it can be used for energy. Without enough insulin, glucose remains in the blood and causes high blood sugar. Over time, consistently high blood sugar can damage the eyes, kidneys, heart, nerves, and blood vessels. This is why effective insulin therapy is so important. NovoRapid is not a cure for diabetes. However, it is a powerful tool that helps millions of patients manage their condition successfully. Understanding diabetes before understanding NovoRapid. To truly understand NovoRapid, we first need to understand diabetes itself. Imagine your bloodstream as a highway. Every meal sends thousands of glucose molecules onto that highway. Now imagine insulin as the traffic controller. Its job is to direct glucose into the body cells. Without insulin, traffic becomes congested. Glucose accumulates in the bloodstream. This congestion is what we call high blood sugar. In type 1 diabetes, the pancreas produces little or no insulin. In type 2 diabetes, insulin may still be produced, but the body cells don't respond properly. In both situations, blood sugar rises above normal levels. At first, high blood sugar may not cause noticeable symptoms. However, over months and years, damage begins to occur silently. Vision problems may develop. Kidney function may decline. Nerve damage may begin. Heart disease risk increases. Stroke risk becomes higher. This is why controlling blood sugar is not simply about numbers on a glucose meter. It's about protecting every organ in the body. And this is exactly where NovoRapid plays a critical role. The science behind NovoRapid. Many patients use NovoRapid every day without truly understanding what happens after the injection. Let's simplify the science. When NovoRapid is injected under the skin, insulin aspart enters the bloodstream rapidly. Unlike regular insulin, it has been modified to absorb much faster. This means it can start working within approximately 10 to 20 minutes. Once inside the bloodstream, NovoRapid attaches to insulin receptors on cells throughout the body. This triggers a series of biological processes. Special channels move toward the surface of cells. These channels act like doorways. Glucose enters through those doorways and leaves the bloodstream. As more glucose enters cells, blood sugar levels begin to fall. At the same time, NovoRapid tells the liver to reduce glucose production. The result is improved blood sugar control after meals. This dual action is one of the reasons NovoRapid is so effective. Why post-meal blood sugar matters. Many diabetic patients focus only on fasting blood sugar. But post-meal blood sugar is equally important. In fact, repeated blood sugar spikes after meals may contribute significantly to long-term complications. Think about it this way. If your blood sugar rises dramatically after breakfast, lunch, and dinner every day, your blood vessels experience repeated stress. Over years, this damage accumulates. NovoRapid helps reduce those spikes. It acts quickly enough to match the rise in glucose that occurs after eating. This creates a more natural pattern of blood sugar control. And that's exactly what doctors aim for. Who should use NovoRapid FlexPen? NovoRapid is prescribed for a variety of patients. It is commonly used by individuals with type 1 diabetes because their bodies cannot produce sufficient insulin naturally. It is also used by many patients with type 2 diabetes when oral medications are no longer enough. Some patients require NovoRapid during hospitalization. Others may need it temporarily during illness or surgery. Certain pregnant women with diabetes may also be prescribed insulin under specialist supervision. The decision always depends on individual medical needs. This is why insulin treatment should always be guided by healthcare professionals. The most common question: when should NovoRapid be taken? This is one of the most important questions in diabetes management. Timing can dramatically affect results. NovoRapid is designed to be used close to meal times. Because it works quickly, it is usually injected shortly before eating. The exact timing varies according to medical advice, meal composition, and individual response. The goal is simple. The insulin should begin working as glucose from the meal enters the bloodstream. When timing is correct, blood sugar remains more stable. When timing is incorrect, blood sugar fluctuations become more likely. This is why consistency matters so much. Patients who understand timing often achieve significantly better diabetes control. Why some patients struggle with insulin control. Many patients believe insulin automatically guarantees perfect blood sugar levels. Unfortunately, it is not that simple. Insulin is only one piece of the puzzle. Diet matters. Physical activity matters. Sleep matters. Stress matters. Hydration matters. Medication adherence matters. Blood sugar control is the result of all these factors working together. Patients who succeed long-term usually develop consistent daily habits. They monitor their glucose. They learn from patterns. They adjust under medical supervision. And they remain actively involved in their own care. This mindset often makes the biggest difference. A reality many diabetic patients don't hear. One of the biggest misconceptions about insulin is that starting insulin means failure. That belief is completely wrong. Diabetes changes over time. The body changes over time. What worked 5 years ago may not work today. Needing insulin does not mean you failed. It means your treatment plan has evolved. Many highly successful, healthy, active people use insulin every day. Professional athletes, business leaders, doctors, teachers, parents, students. Millions of people around the world use insulin and live productive, fulfilling lives. The key is understanding the treatment and using it correctly. And that's exactly why learning about NovoRapid is so important. Why this knowledge can change your life. Imagine driving a car without understanding the dashboard. You might still reach your destination, but every warning light would create confusion. Insulin works the same way. The more you understand your medication, the more confident and safer you become. Knowledge reduces fear. Knowledge improves consistency. Knowledge improves outcomes. And most importantly, knowledge helps you protect your health for years to come. So whether you're newly diagnosed, have been diabetic for decades, care for a family member with diabetes, or simply want to learn more about insulin therapy, understanding NovoRapid FlexPen is one of the most valuable investments you can make in your health journey. And this is only the beginning of the complete story.